everyone, welcome to Real Talk with Biha Care. Today is World Health Day, and we would like to shed a light on a topic in healthcare that is often ignored or overlooked, and that is mental health. Our guest today is Sharon Jepson Emmanuel. She's a psychologist who has assisted clients from various walks of life to overcome a mirage of mental health challenges. She's currently a psychotherapist at Ndidi and also volunteers with the Stand to End Rape initiative, where she provides therapy for survivors of sexual and gender-based violence. She is a volunteer member of the Lagos COVID-19 Psychosocial Response Team, where she functioned as a frontline health worker during the pandemic, providing mental health care for survivors. She has experience in drug rehabilitation, stress management, trauma, crisis management, anxiety, depression, self-esteem development, and a wide range of mental health challenges. Hi, Sharon. Thank you so much for being here on the podcast today.
Thank you so much. Good morning.
Good
How are
morning.
you?
I'm good, thank you.
Nice to be here. Thank you for having me.
Let's get right into it. In your own words, can you please tell us what is mental health and mental health illness?
Thank you very much. Mental health itself is not defined by an absence in mental illness or any other disease or anything. Mental health would be on three different fronts: emotional, cognitive, and behavioral. When a person is able to realize their own potential, to be able to make the best of opportunities around them, and the person is able to cope with life stresses, that means the normal life stress is able to cope with them, has resilience, and is able to pull through. When a person is also an active contributor to the community and environment around, it means that they're able to function in whatever roles they are found in. They're able to be an active part of society, be an active link in society. So this person, mental health it's all encompassing. Being able to be healthy, being able to realize your best potentials, being able to go through life stresses, normal life stresses, being able to be resilient, to be able to also assist others and to also receive assistance. So mental health is all encompassing. It's not just looking at, oh, this person is fine, this person does not have this. So long as this person does not have this person is fine. No, but mental health has to do with much more healthier living than looking for.
A lot of people don't really know how serious it is, or they say that it's not something that affects Nigerians. Like, people don't believe that there's any such thing about mental illness in Nigeria. Can you tell us about its prevalence in Nigeria?
I think the major issue people usually have is that to define mental illness or mental health itself, like I said earlier, they look more at illnesses. So once a person is fine, or they perceive a person, they think a person is fine, they feel that everything is okay. But mental illness, a whole lot of times, does not have to be something you see with your eyes. And sometimes if it's not something that you can be able to define on your own, if you're not so equipped to the skills to be able to point them out. Now, the WHO as at 2020 says that every 1 in 4 Nigerians has a mental illness. That's with our population, that's like over 50 million people. And that's even the ones that we know. So it means there are many people who are suffering from mental health issues that we don't even know about. So the rate and the prevalence of mental illnesses in Nigeria is very high. And I'm even saying that this is even for the ones that we know. There are people who don't even have access to basic physical health care, not to talk of mental health care. So these are just figures of people that we're able to lay our hands on, and it's still that high. So yeah, in Nigeria, among the Nigerian population, there is a mental health issue that needs to be really faced. So people who say that it's not a Nigerian thing and don't suffer it are either people who do not know how to define mental illnesses and point them out, or people who are just totally ignorant.
Yeah, I like how you said that it's not something that you can see or know. Can you please talk about some of the symptoms of mental illness and possible triggers or risk factors? Like, how do you know if someone is suffering from mental illness? What are the common triggers that cause somebody to go into that state or to feel that way?
Okay, common triggers or pointers to the fact that a person has mental illness. There's one thing I would like a very simple way. One simple way is a change. When you notice a change, like I used to say, it doesn't have to be a low change. It could be high. For example, okay, let me put it like this. When you notice a change in a constant behavior or personality type of a person, something that is not usual with the person, and then you begin to notice a high in it or a low, then there's need for attention. For example, somebody who is generally quiet, generally reserved, somebody who is comports themselves, sorry, somebody who is gentle and all of the person is high and everywhere, so social, so this, so that. You get what I mean? Somebody who you would generally define as an easygoing, gentle person, does not really like too much social interaction, and all of a sudden this person is everywhere. You need to check to be sure that things are fine. And if it's somebody too who is everywhere and everything, and all of a sudden the person is on their own, gentle, not wanting to interact and all of that, you check. So whatever change, either somebody sleeps before 6, 7 hours and the person literally doesn't want to leave bed, you need to check. Somebody who doesn't sleep at all is now sleeping so much. You need to check. Somebody who sleeps so much and now sleeps so little, you need to check. Someone that eats so much before, now eats so any change, you notice a change. And then if you notice a change in personal hygiene, you notice a change in care for self, it's time to also check. If you notice a person's attitude towards work, things they used to do is beginning to have a change. So that's why I like to term it as change in general. When you begin to notice a change in a person, because that's usually what we wait for to know if a person is fine. Because mental illness is best understood and defined within the context of human relationships, in the sense that if a person keeps to themselves, a whole lot of times you might not be able to understand what's going on. But it's in interactions we're able to know that there's a change in level of interaction, and there's an inappropriateness. This person is behaving in a very inappropriate way within the context of social interactions. So many things to look at. Basically, I would term it as change. Change. The person who is usually not aggressive is going to flip and get angry and all of that all of a sudden. You need to check all of this. I would say things to check out for are just basic changes in the normal or what we are used to about the person. So it's not definite that something is wrong. But it could just be that at that point the person is going through a lot of stress, so that it doesn't move into something higher. It's at that point that we're able to know we've detected it early to be able to manage whatever stress, so that stress does not now become a permanent thing that we're managing.
Yeah, so I get what you're saying about change, but I'm just thinking out of curiosity. Supposing you meet someone that is maybe suffering from mental illness, and it's not like you knew the person before, so you can tell that, oh, this was the change that happened. I feel like most people are insensitive to such situations. So you could meet someone that is suffering from this mental illness, and maybe the person is depressed and you don't know, and then you just go ahead and say some things that are like triggers for that person, and it could harm the person in a negative way. So if you don't really know somebody, is there a way to tell or a way to know that yes, this person has an issue or this person is suffering from mental illness?
First and foremost, to even be able to make an appropriate diagnosis if a person is suffering from a certain mental illness or the other, it's usually important to take history, meaning that we get a very reliable source who can help us do it before and after, who can help us to do it then, and somebody who can give us context into changes that have taken place. That would be able to help us to know areas where we can put together signs to be able to say, oh, this is this, then this, for this to happen, then it can be this is this. So if you don't know a person, it is really difficult to be able to say, this is a change that occurred, because you don't have prior information to what you're having now. You can just have suspicions, and suspicions based on, like I said, human relationship. Some things are inappropriate. You just notice that this person does certain things that are not the norm where we are found. Mental illness also is defined within the context of norms. because what is mental illness here might not be mental illness in another society. What's mental illness in another society may not be mental illness for us here. So a whole lot of times we define mental illness also based on the statistics and the norms of what is going on here. So if, for example, somebody who grew up in a certain culture, you also grew up in that culture, or just within a large perimeter of a mixed culture, like Nigeria has a whole lot of cultures, but we know certain things are Nigerian like. Do you get my point?
Yeah.
We know certain things that are our context like. Now you meet somebody for the first time, or just recently, and the person is doing certain things that are not so cultural, certain things that are just not too appropriate, that you're not understanding because it's not the norm. You might not immediately tag it as mental illness. You may just tag it as something off and weird. Take, for example, okay, the usual thing is that when you meet somebody for the first time, you try to get to know them and all of that. And then you meet somebody who just met you literally an hour ago, and the person is all high and shouting like they've known you for decades and decades. There's this certain reservation of, okay, is everything okay? This over familiarity and all of that and all of that. It's one of the things you see in manic people, that excitement, that acting like they know you already for so long and all of that. That may not be such a great example, but what I'm trying to say is that if you're meeting somebody for the first time, you lack context. You lack historical context. But at least from time to time, you can know when some things are off. So it's not like you have a categorical, this person is ill, but you just have suspicions and, okay, is everything okay? So if it's now something that, you meet the person another time and it's not there, it's okay, what really happened that day, bring it up as a discussion and all of that. What I'm saying is, meeting a person newly, you cannot categorically say something is entirely wrong, except if you're a health practitioner. And even as a health practitioner, you still need the help of family and friends to give you context. Because I don't know, you don't know this person from anywhere. You don't know this person from anywhere. You cannot just go about labeling people. When you say, oh, this thing has happened, this person has this, so I give this diagnosis, because based on history, there's been a deviation. And if it is, sometimes, this thing it has persisted for so long, there will be something we can point out to, either during childbirth, when mother was pregnant, when baby was being delivered, while the baby was in infant stage. If something was off, something went on, then we'll be able to say, okay, from this baby fell down at this particular age, and then we began to notice that this, that, the mother had prolonged labor for so long, this, that, during pregnancy, or I noticed the pregnancy was like this, and we have places to look at. And even with all of that, a health professional still needs context. How much more somebody who's just meeting somebody who's a layman? So it's really not ethical to go around just saying this person has this or this or this, especially for someone you just met, when you lack context. The context is really, really, really important in being able to diagnose anything or say for sure. But you can have your suspicions based on, we are human beings, we have social interactions, and we know what, in quotes, should be.
Yeah. I know that there's not a general cause for mental illness. A year ago, we conducted a study concerning depression only, not like a general mental illness. And we asked people about what they feel causes their depression and things like that. And everyone had different things to say, like maybe lack of employment, different things like that. So I'm just wondering, in your experience as a psychotherapist, are there like some general causes of mental illness that you've seen so far?
For different people, it's different things. Even that person that mentioned unemployment is right. Even your socioeconomic status can really affect your mental health. Poverty itself can affect mental health. When quality of life is low, you don't have access to the basics of life, that culminates into frustration, it culminates into stress. And once a person is being stressed, not only has it become a situational issue, it's also becoming biological. Because your body begins to release certain chemicals and things that either place pressure when you're stressed, you place pressure on certain organs. For example, a
Yeah.
person who is stressed and so much, a lot of times they place so much pressure on their heart. All of that is now becoming something that is both biological and mental. So yeah, a lot of things could trigger mental health issues. So yeah, let me start from the fact that it could be biological. It could be something that is in a person's makeup. Like if you've had somebody in family who has had mental illness, the
Yeah.
closer the person is to you in relationship, the higher the risk of a person having a mental illness. So take for example, if a sibling has mental illness, that's a higher risk compared to if it's a third cousin or one distant uncle from somewhere.
Mhm.
Yeah, so the closer the person is, the higher the risk. So sometimes it could be biological in the sense that people have predispositions to it. And such people, once a person has noticed that, oh, certain people in my family have this, or are managing this, or I have a parent who is always managing anxiety or depression, such people, it's just be advisable that they stay away from stressful conditions, that they stay away from use of illicit drugs because these things trigger. So that would move me to the other thing. It could also be environmental in the sense that the environment in which a person finds themselves so stressful that literally they didn't have in them that resilience to be able to go through the stress. They didn't have that wealth of strength within to be able to pull through, and then the situation got the best. So yeah, environmental factors like stress, being in a violent environment, war-torn environment, born in the middle of war, sexual violence, physical violence, in fact, psychological abuse, mental, every form of abuse could lead to one form of mental illness or the other. And mental illness, some people have this wrong notion that mental illness has to be aimless wandering, in the sense that they look at the typical mentally ill person on the road who's walking around wearing tattered clothes, and that's their definition of mental illness.
Yeah.
It's possible to be mentally ill and still be looking so fine and still literally be able to pull through, in the sense that you're just able to get two and two together. But within, a whole lot is wrong. And it is beginning to show little by little in various aspects of life. So mental illness does not have to be permanently defined by that person we see walking around tattered and naked on the street. So it means that environmental factors could affect also where you're born, how you're raised, parenting style, how parents raise kids. Is it a violent environment, a very non-supportive environment? That also in itself could trigger mental illness over time. Could even trigger wrong coping skills, such that people are not able to effectively manage stress, and then it gets the best of them. And then, like I said earlier, use of illicit drugs, cannabis, cocaine, heroin, all these things. A person who already has a predisposition before that goes ahead to use these drugs is just quickening the process. Because a whole lot of times, people that we see on the streets, I don't know if you ever noticed that there are some mentally ill people who we see walking and wandering around on the street who smoke. I don't know if you've ever
Yeah.
seen them smoke before.
Yeah.
Some of
They
them, it's
smoke
not
and
like
they
as if it's
buy all those alcoholic drinks, those little ones that they sell on the road and everything. Take it.
that shows that some of them, what got them there, some of them could be drug addiction. Because drug addiction, when not managed, when a person, drug addiction at its extreme can make a person to begin to hallucinate, to be delusional, to say a whole lot of things, and then it begins to look like it's biological. But drug abuse could trigger like schizophrenia. It could trigger a whole lot. So it could either be biological or lifestyle based. So that's why illicit drug is a total no-no. It's a
Yeah.
total no-no either for somebody who has a predisposition or for somebody who does not. Even if you don't, drugs rewire the brain. They rewire the workings of the brain, and over time it leads to dependence that is so bad that everything in that person's life is centered around getting these things. So I mentioned environmental causes, biological causes, lifestyle. The lifestyle could also life stresses, lifestyle, what we're engaged in, all and all of that could trigger mental illnesses.
Yeah. I totally agree with what you said. I think the general definition of mental illness, especially here in Nigeria, I don't know about other places, is that in quotes, see a mad person
Maybe on the
walking
street.
on the roads, either maybe the person is naked or the person is in tattered clothes, and
Yeah,
you're just told to stay away from that person, that that person has issues and things like that.
yeah.
So yeah. Um, Personally, the when you say that having a family member or someone you know in close proximity, I just wanted to ask about that because different I've seen in a couple of movies where they say okay, the mom suffered like from mental illness, maybe schizophrenia or something like that, and then they make it sound like it's something that's hereditary, that just merely because of that the child is also going to have that. Is it something that is hereditary, or it's just like if you're in close proximity to the person that had it? I don't know if you
What,
get what
what I meant by close proximity is not close proximity alone environmentally. I was talking majorly about close proximity biologically.
okay. Okay.
Yeah, so a sibling having it is not because you and the sibling are living together. It's because you and the sibling have the same parents. So
Oh,
you are closer than if it's a cousin that has it.
yeah.
Yeah. So a relationship, a person in whom you are related to, you know, how close that relationship is. For example, immediate family is very close compared to auntie and uncle and compared to cousins. So
Yeah.
if a sibling has it, there's a higher chance of having it compared to if one great aunt had it, had mental illness had been managed over time. Yeah. So yes, schizophrenia can be hereditary. It can be hereditary,
Okay. Okay.
and then it can also be lifestyle induced and environmentally induced.
Yeah. Knowing what the causes are, or like the different things that could trigger it and all that, are there any ways to prevent mental illness and ways to help somebody in need?
Yeah. So like something I generally like to say is the fact that mental health care
Yeah.
for our mental health is a proactive thing. It's not reactive. You don't wait until things are so bad and you begin to find a solution. Just a general mindfulness for yourself, knowing your limits, knowing when you're stressed enough to relax, you know, understanding when situations are beginning to get at you beyond normal, not staying in toxic environments because you want to have a harder front. You know, taking time off to relax and attend to your own self too, because everyone is an active part of society. Everyone should be an active part of society. Everybody is important in whatever role they are functioning. And understanding the fact that you are important means that you also give yourself premium and attention. So I would say the best way to prevent whatever and care for your mental health to be mindful of your own self, to be mindful of how things are affecting you, to seek help and assistance, to as much as possible reduce self isolation. I don't need people this the kind of human relationships we have and the quality of our human relationships help our mental health. It really does. That social interaction, that phone call, that visit, that that extending a hand of invitation to somebody, allowing people to get to know you and also getting to know people, giving yourself time of break, going to the hospital when you have physical health issues, like okay, not for example, the mind and the body are like twins, and they mirror each other a whole lot. If something is wrong with the body, our minds, our mental health gets dragged in because it's almost like a solidarity. It's almost like you are living in the same house with the person. When the person is mourning and you're having a party, that's disrespectful. If you get my point. So
Yeah.
if something is there's illness in the physical body, you see our minds take it, reflect it, and at that moment they are gentle and affected. If something is wrong also with the mental health, the physical health takes it. Sometimes people have physical bodily sensations, pain in the hand, pain in the chest, pain in the back, that they've done every test possible to explain, but they can't. There's
Yeah.
nothing biologically wrong. You know, at that point, you say, at first, beginning to somatize in the sense that whatever stresses and pain they are going through mentally is beginning to show off in the body. And that's because the mind and the body are so close and they mirror off each other. So even taking care of your physical health is very good for your mental health. Because if a person is careless with their health, it has now um, gone into an illness that the person has to manage for life. That process of adjusting from when you didn't have that illness to when you had that illness can be very traumatic. You're about to put a spoon in your mouth and then someone tells you, you've forgotten you can't eat this. And like, oh my God, you've forgotten you can't do this. That change in lifestyle itself can really affect mentally. So taking care of your physical health also is very good for your mental health, and vice versa, taking care of both. So ensuring that you're mindful of yourself, you don't bite more than you can chew, you seek assistance from people as much as you can, get benefits from relationships. And what I mean by that is that interaction of being a shoulder somebody can cry on, and having and taking it, and also having shoulders you can cry on. That symbiosis, that I give you, you take, that beauty in itself keeps us healthy. When we put ourselves in positions where people can really assist us and we can assist others, we are mindful, just general mindfulness. You notice anything, you're careful enough to act. You notice you're sad and unhappy, you're mindful enough to be able to cool down or calm down, ask yourself what really happened. Managing stress well, not doing more than you're already going for three weeks. Some people cannot even boast of having slept 5 hours in 1 month. 5 hours consistently at night for 1 month. Some people do 3 hours, 2 hours. At the end, you break down. Ensuring that you eat well, sleep well, rest well. See, as little as eating and sleeping, they're so important. So important. In fact, they're usually the first indices you check out for, to check if the person is fine. They ask, how are you sleeping? And somebody is telling you, I barely get 3 hours. It will affect you because your brain needs that rest. You ask a person, are you eating? And this person is not eating well. So your feeding, your sleeping is so important. Your human interaction is so important. Proactiveness to your physical health is very important. Lifestyle choices, alcohol consumption, illicit drug consumption, as much as possible. If it can be avoided, it will be very great. And being involved in healthy social interaction, having and building great social and human relationships is so great. And ensuring that whatever form of employment you find yourself is not an employment that chips at your self-esteem, an employment that makes you feel less than you can. As much as possible. Yeah, it seems impossible in Nigeria, but it is great if we can get jobs that build our self-esteem, jobs that help us feel better about ourselves, jobs that don't change goalposts, if you get what I mean.
Yeah.
Jobs that you are able to see your upward mobility. You're able to see it clearly that, the more I put in effort, the more my career gets better and I go higher in this thing. So also the kind of jobs we pick up, our jobs also affect our mental health. Jobs that give you time to also take care of you, because whether we like it or not, businesses are run by people. And if the person is not healthy, you do very unhealthy things on the job. So ensuring that all these things are covered, our jobs, social life, our health, our physical health, our lifestyle choices and all of that helps to be able to maintain mental health. So you don't just focus on mental health. Mental health, you focus on every aspect of your life and ensure that everything is going on well. And then you also asked about managing one, either for someone else or for yourself if you have a mental illness. One key thing about managing mental health or mental illnesses is consistency. If you have found a way to maintain it or manage it, you have to be consistent. So if you're using medications, therapy, and if you are using either of both or a combination of both, consistency is really key. So you cannot take medications today and go on a break for 2 months, come back again. It has to be something really consistent. So to be able to manage mental illness, stick to whatever it is that your physician has said, whatever it is that your doctor has told you to do, stick to it as much as possible. And one thing I like to encourage people is don't look at it as I'm swallowing drugs every day, having to see this therapist every day. Just take it 1 week at a time, 1 day at a time, knowing that these things are helping you to get things going. Just ensure that you have what you have for today and for tomorrow. Yeah. So staying with what your physician has said, and then over time, I'm saying this as somebody, I'm giving these tips with the belief that it's a confirmed mental illness, meaning that it's already being managed. Yeah. So if that's the case, over time, you found your triggers, we found things that happened, patterns and all of that. Now that you know, it would be a great thing to be able to avoid such triggering situations, be intentional about ensuring that your environment does not bring or do the good work you've been doing with therapy and with medications. So as much as possible, finding locating yourself or being intentional about being in very tranquil environments that really help promote your care and your management. Now, if it's for someone else, you're seeing someone else who's managing, it's not the time to be using derogatory words. Like, I particularly hate that word madness. I particularly dislike that word. Saying this person is mad. There is no mental health field that would ever tell you that madness is a diagnosis for anything. It's not a diagnosis. There are no drugs to treat madness. There are no therapy styles or techniques to treat madness. Madness is a social insult. When a person is mentally ill, they're not mad or insane. Using such things for people, when you notice a person is managing something,
Yeah.
just normal care. More than anything, they need social interaction, not isolation. And one key thing, so they need social interaction. So it's not the time to keep away. I don't want to. No, come close, discuss with them. How are you? Interact like everything is going well, because everything is, because they're managing it as effectively as they can. And for people who have close people who are managing one form of mental illness or the other, this is not the time to be making choices on their behalf. You literally take over their whole life. You make choice of what they will eat, what they will wear. One beautiful thing also in that social interaction, that what do you want to eat, what do you want to taste, those basic things that they can't take, for decisions they can take for themselves. Allow them do it. So this is not to say that mental illness means you're totally unable to care for self. No. So I'm just saying, for example, if it's someone who's dependent on you and this person really can't function anymore, it's not time to make you complete everything for them. Involve them also in things that involve their lives. Be empathic, be non-judgmental, do not isolate. That's not the time to lock them up in a house. You don't allow anybody come out. You don't allow anybody see them. Social interaction is really great for our mental health. Social support is really great for our mental health. Human relationships, they are really great for our mental health. So unhealthy human relationships, they are really, really bad. So you help people by managing and also facilitating care and information. If you hear about anything that helps whatever it is that they're managing, don't just suggest, I saw this somewhere, do you want to check it out? I heard about this, you want to do in a very respectful way. In a very, very respectful way, not just you're in public and I heard that this, as much as possible, privately in an empathic way, bring it up. So facilitating information, getting to them too, is a very great thing. And also ensuring that they eat well and they sleep well. And noticing changes in them. When you notice changes in them, bring it to their notice. I noticed that this is it. Everything okay? And all of that. Taking notes. Taking notes of changes and positive changes too is also great. So that when next they go to see their physician, you're able to say, this person has improved from this to this.
Yeah.
Have someone close, ensuring that they don't miss their appointment, ensuring that they always have their meds, they always go for their therapy, whatever. Ensuring that they are just always close to care, ensuring that their social interaction is still as great as it should be, and also just being there for them. That's it. Really being there for them.
Yeah.
That's what I would say.
Yeah, that's really great. I feel like there's a major stigma surrounding the issue of mental health. Like, I'm just using Nigeria every time I talk because that's what I know of. So
Okay.
the whole generalization of people with mental illness as they are mad, it causes this stigma where sometimes when you see someone who's going through trauma and you try to get the person, okay, talk to a therapist or do something about it before it becomes serious or you have some major form of PTSD or something, people get defensive and they're like, oh, I'm not mad. I don't want anybody to put me in one mental home or this, that. And then even with regards to the care of mentally ill patients, I know there are organizations that do their best, that do a good job in helping these patients. But I remember last year there was a viral post going around of a mental institution where they basically chained the patients to the beds. Some of them didn't even have beds. The living conditions were subpar. It was really horrible. Like the images were just so graphic. These people had emancipated. I wasn't even sure if they were being fed there and all that. And everybody just sees them, the general public rather, sees them as people that are mad and they should be locked up. Nobody really understands like care and all that. So I was doing some research at some point, and then I read about like there was a Nigeria had a mental health policy that was created in 1991 and a whole lot of stuff. And I think till today, well, as at last year, it hadn't been passed into law and all that with regards to the rights of person with mental disorders and the equal access to treatment and their care and all that. So, as a healthcare professional in that field, can you tell us on some of the actions that are currently being taken and like anything that you feel like should be implemented that is not being addressed right now?
So a lot of the action being taken with regards to mental health issues in Nigeria, sadly, are more private than governmental, in the sense that private individuals and NGOs are really at the forefront of care for mentally ill people or people who might have mental illness as a result of things that they've gone through. Take, for example, one form of violence or the other, survivors of one form of violence or the other, being there to ensure that it doesn't become a mental illness issue for them that they have to manage. So currently, I would say that, yeah, there are laws on their rights and all of that. So the truth is, apart from the fact that the general public isn't even aware of that, the implementation is little or nothing. But a lot of times, I think one thing that where help really is needed is awareness. People being able, is it people who, this is how I used to say, you see, when a person does not even have access to physical health care,
Yeah.
mental health care is like luxury. In fact, saying you have mental health issues is like something that is left for the rich and people who don't have any other problems that begin to form problems. Because some people feel saying you have a mental illness is like forming problem where there's no problem. They ask you, are you healthy? Are you sick? You're not physically, you're not sick. Are you hungry? You're not hungry. So what's not your problem? Can you now be saying that you get that kind of thing? So it's like really mental illness for people who are jobless. So that starts from even awareness on mental illness and the fact that having a mental illness does not mean you're weak, does not mean that you are useless, does not mean that you will totally become dependent on everyone. That in itself will now help us to be able to now bring up the laws that we have in Nigeria and all of that. But for what I think can be done, from what I've seen so far, is the fact that even people who have come forward to say that they have one form of mental illness, to come forward to seek help. The financial implications of taking care of mental health, that financial burden, having to care for your mental health, is a whole lot. So I feel a lot needs to be implemented with regards to the pricing of mental health related things, generally in Nigeria, health in general in Nigeria. There needs to be a whole lot of subsidization. We need to subsidize a whole lot of things. Pricing of this, pricing of that, and also much more policies for workplace, for employers. It's not when you hear that somebody is mentally ill and that's when you now stack and throw away and the person can't get a job anymore. So a whole lot needs to be done in the place of financial support for care, being able to even get mental health insurance in this country, to have mental health insurance where if you're having mental health issues, depression and all of that, it's subsidized. You're able to have it on your insurance plan to be able to get help. Also with our jobs and all of that, to ensure that people don't lose jobs or source of, because once a person is managing a mental illness and then loses their source of income, how do they even fund the care? To fund the care is another thing. Now that effect of the fact that, I've lost my job, I'm unemployed, in itself can begin to also increase and affect mental health care and how it's going. Because a lot of times when people are gainfully employed and engaged in something, it helps to keep them active and interactive with people. You get my point? It helps to keep them. It helps to keep them in human interaction, and that in itself helps. So, what I think that needs to be faced in this country is regards pricing of healthcare access, the price for care, and also labor laws to be able to support mentally ill people. Apart from even that, also the healthcare facilities and the healthcare professionals, even the mental health care professionals, in fact, healthcare professionals in general, need more hands, need much more hands. The demand is so high, there's a need for more hands, there's a need for more care from mental health experts, more equipment, more instruments. Everything is it's all around, from the hospitals right down to the person themselves and their personal life. A whole lot more needs to be done with regards to governmental policies, because there are private individuals here who are doing well enough to be able to provide these services to people, but it doesn't come at a cheap price. It does not come at a cheap price at all. At all. It doesn't come at a cheap price. But how many people can afford that? Sometimes if people's denial of mental health issues is not because of the social stigma alone. It's also the financial implication. Imagine having to buy drugs continuously for a long time, or having to see a therapist, all those kind of things. And it's necessary that people do, because to say that we're not having a mental health issue in Nigeria, it would be to be living a lie. That would be to be living a lie. So the government in general, as human beings, also we have a whole lot of role to play in ensuring that people who, or anyone who is managing one form of mental illness or the other, is getting the best care that they can within their means, and they're also able to not lose their life because they're managing one form of illness or the other. That a person is going through something at a particular time does not mean the person becomes jobless, and then getting another job becomes a problem for so long. That in itself will affect how a person gets better.
Yeah, that's really good. I totally agree. The implications of healthcare, not only mental health, healthcare in Nigeria as a whole is very high. And like you're talking about someone that maybe could have gotten depressed because of lack of employment or something like that. So
Yeah.
there are no funds in the first place for the person to get access to treatment and all that.
Taking care of poverty in itself, taking care of the socioeconomic status of the people, taking care of quality of lifestyle would
Yeah,
have a great improvement of mental health. A
yeah,
lot of people, apart from even let's put the biological aspect aside, a whole lot of times mental health issues we have are based on frustrations from the external. Frustrations, things that have happened. If you get my point, lack of access to basic things. Some people, they are whatever it is that they are going through, their depression was triggered by probably the death of a loved one that could have been prevented. So if that death had been prevented, this person would have not had this to manage. And here they are blaming themselves that they are done for. So it's a whole lot. A whole lot. But when you increase quality of life of the people, it reduces the mental health burden to a certain extent. It reduces the mental health burden and access to care early enough. So it would even affect education too. It would affect education, because if mental health issues, mental health topics are infused into our curriculum and people are aware from a young age of the fact that certain things do exist and there are certain early cares you can give to get better. The more educated the population is, the more they are willing to come out. The reduction in stigmatization. When we keep quiet, we don't talk, we don't say anything, we keep it as a gray area. People are unaware when they need help. And when they finally see somebody who has stepped out for help, it becomes a laughing point because it's a strange thing. So it affects everybody. Education, it affects government policies, it affects healthcare sector in general, it affects everybody.
yeah, totally agree. So this is for the audience, for people listening who may need help in some form of way. How can they contact you or your organization? it or reach out, like if someone needs assistance in certain issues?
Okay. I work at NDD, and we're literally everywhere. But for now, we do a lot of teletherapy for people from the convenience of wherever you are in the world. So we provide mental health care. So you can just go to ndd.me, ndidi.me. Yes.
Yeah, so I'll also
So
link that in the show notes so that someone could just click on it directly and get there. So thank you
okay.
so
So I
much.
think
Thank you so much
okay.
for joining me today. Thank you so much. It was really, really insightful, and I hope that we can get to a point where it's no longer a stigma, it's no longer an issue where people are thinking of financial burden and cost, and where it's something that we can get better as a nation concerning mental health and health in general, hopefully. Thank you so much for showing up on the
Yeah.
podcast.
Thank you. Thank you for having me. It was really great having this discussion, and I hope that over time
Yeah,
we get to a point where mental health topics and mental health issues are not things to shy away from. And just the way you would be very proactive and unemotional about treating a headache or a stomach upset, we become so for our mental health, and then watching out for each other to ensure that whatever it is you're putting out there, you know there's another person who gets to receive it. In the sense that we all exist within social interaction, not understanding the fact that your words and your actions affect somebody one way or the other. Being proactive not only for your own mental health, but for the mental health of the next person beside you. Means you're conscious of what you say, conscious of what you do, conscious of what is funny. A lot of times we laugh at things that are really not funny.
yeah,
Speak to people, talk down. So mental health issues, I trust that over time it becomes something that not only are we proactive for ourselves, but we're also proactive for the next person beside us. We are careful enough to create environments that are very mentally healthy for people. Create environments where even people managing mental illness can thrive, and it's not so hostile that it's either you come out having a mental illness or you are unable to manage one if you are. So I look to a time where mental illness topics are things that even we discuss with little kids, where everyone is able to, one way or the other, help the next person beside them to be able to face life, to be able to overcome stresses, and to be able to achieve goals and aspirations that we have.
yeah. I totally agree, and thank you so much for your insight on
Thank you.
everything.
Thank
Yeah,
you very much.
thank you.
Thank you.
Thanks for listening to this podcast. Click the link in the show notes to subscribe to our podcast on your preferred platform. And also subscribe to our YouTube channel for more episodes. Thank you.